in those pillars that you were talking about, the women's health coach, the coaching skills, the functional nutrition part of it, and the business model part of it as well. I think there's a couple underlying things, and you've mentioned it. One is community. That for so many of our students, for the women in this program, it's that sense of community, like you said, that safe space, that sense of community, where they, for the very first time, feel it's okay to ask questions about yourself and to trust your intuition, and to have that guidance and the support from not just you on the live calls or the master coach, from other students. That community aspect is just something that is very needed, that they're looking for. But when they enter the program, I don't think they're clear on the amount of support and community that they're going to have in the program.
Yeah, I think one of my proudest things about this program is that people have come into, say, the Women's Health Coach Certification Program, like literally in 2009, 2012, and it's now more than a decade later, and they're still in our community.
Community. Yep.
They're still posting on our Facebook groups. They're still coming to our live community calls. They're still participating in our continuing education, because we always stay on the innovative cutting edge. And what's so cool about that is exactly what you said. Myself and our faculty are very accomplished and have lots of interesting experiences and support to share. But how exciting that you also get access to literally several thousand people who have been through this program, who live in more than 60 countries, who are dealing with different kinds of medical systems than we have in the United States. We're all across Europe, we're in Australia, we're in Canada, Mexico, South America, and beyond. And I think what's so exciting about that is, things like, for example, in the United Kingdom right now, there's a big push regarding talking about menopause in the workplace. And one of our graduates is really on the leading edge of that. I get notes all the time from people saying like, oh my gosh, I was approached by my state or even federal, national government to participate on panels about certain topics, to help actually write laws about those, and supportive, even direct funding for different women's health issues that those countries are uniquely concerned about. So the sky really is the limit. And sometimes people's priorities is really to think about, okay, how do I want my life to fit in with my family and my friends, and like my work to fit in with my actual life? And even on a smaller scale, where you're not maybe impacting things nationally or globally, in your community, which we have, hundreds of examples of, what exactly does that look like? How does somebody do that and also raise 3 kids? Or what if I'm still breastfeeding? Or, what if I'm taking care of my mother who has dementia? It's very likely that someone in our community has already done this and is right there to support you. So yeah. I really love that. That's one of the proudest things I feel about this community.
Yeah, I agree. Absolutely.